Dr. Patel, could you define what relapsed myeloma is?
Yes. So as of today, for the majority of our patients, we can't cure myeloma to the point where we treat it and it's gone forever, right? I'm hoping one day we get there and we're getting better, but we're not there yet. And so that means, however, myeloma is very, very treatable. So what relapsed means is that once you've had initial therapy after you've been diagnosed, our goal is to get that myeloma to as low as possible level so that it hibernates as long as possible. But eventually that myeloma is going to start waking back up. So when it does, that's called a relapse. Now the proteins are coming up, the myeloma cells are growing. We need to do something to knock it right back down again. So that's relapse disease.
How is that different from refractory myeloma?
Yeah, that's a great question. We talk about relapse, refractory all the time, for myeloma. So refractory actually means that your myeloma started waking up while on a certain medication. So if you were on no medicines and then your myeloma came up, that's considered relapsed. That's not refractory. However, biggest example I can give you is when patients are on maintenance therapy after stem cell transplant, for instance. When they're on maintenance and their myeloma starts coming up while on maintenance, then they are considered refractory to that drug. So if it's lenalidomide, if it's bortezomib, whichever one it is. So anytime the myeloma is coming up while on active treatment, you become refractory. So we talk about, triple refractory or penta-refractory. And what that really means is how many drugs is your myeloma refractory to. So if you're refractory to, a proteasome inhibitor plus an immunomodulatory drug, plus a CD38 antibody, right? I can give you examples of all of those, but basically different categories, then you're considered triple refractory. And the more refractory it is, the harder it is to treat, and the more novel therapies we need.
Yeah. So if a patient is taking 3 or 4 different drugs, how can you pin it down to know which drug or all of them are causing the refractory myeloma?
So it would be all of them. If you're truly on, let's say, 3 drugs, right? Let's say salvage therapy, you're on 3 different medications or 4 different medications, usually 3. We would say if the myeloma is coming up while you're on all of them, you're technically refractory to now all those medications.
All of those.
Yep.
Okay. All right.